In the 4 minutes you are going to spend watching this video, 14 Europeans will die from cardiovascular disease, the leading cause of death in the EU. Cardiovascular disease accounts for 37% of all deaths, 1.8 million lives lost a year, and 20% of deaths in people under 65. The disease costs the European economy €210 billion per year. These numbers are set to increase significantly. Europe is already the most aged continent on the planet. Life expectancy is rising and medical professionals are lacking. The sustainability of healthcare systems is at risk. In Madrid, 35 to 40% of patients with a risk factor for cardiovascular disease are currently not monitored by the health service. 50% of those who are monitored do not have their risk factors under control. A similar picture can be seen throughout the EU. Despite the efforts being made to tackle the difficulties, challenges remain. Little awareness of the disease and its risk factors in the general population. Low levels of education and preventative information provided to citizens by the health service. Insufficient follow-up of diagnosed patients. The solution? Healthy Beat, a new, more effective and efficient model for the management of cardiovascular disease. Healthy Beat is a personalized virtual care service. It allows professionals to monitor and follow up on cardiovascular risk factors whilst providing patients with empowering tools that allow them to share responsibility for their health through improved lifestyle habits and self-care. Post-COVID, citizens are now accustomed to using their virtual health card and having direct access to their personal health data. It is time to take advantage of this shift to launch a project that empowers the entire population. Healthy Beat focuses the intervention on cardiovascular risk factors throughout an adult's life, providing comprehensive care to both healthy and sick citizens, seeking the greatest population coverage, accelerating the detection of disease, and improving the monitoring of risk. This allows for a preventative approach that promotes health and reaches a population that does not always access primary care. How will we do it? By integrating the Healthy Beat platform into the health systems of Madrid, Spain, and Lodz, Poland, making the service accessible to any citizen with a virtual health card. By building on the learnings and pre-existing technologies of telemedicine projects already developed for cardiovascular patients. By facilitating the exchange of information between citizens and the health service, allowing risk factors to be monitored and alarms to be raised when an intervention is required. By establishing a risk awareness traffic light system that signposts individuals to personalized preventative and health promotion activities and training. By seeking feedback through PREMs, patient-reported experience, and PROMs, patient-reported outcomes, questionnaires. We consider Healthy Beats to be a unique tool because it allows health information to be exchanged at the primary care level, is aimed at the entire adult population, potentially 6.5 million citizens, provides tailored and personalized care, makes individuals co-responsible for their own health, allows preventative actions and early detection. Our analysis concluded that there is no comparable tool in the European market, despite the large number of interventions carried out in the EU. Through Healthy Beat, our goal is to significantly reduce the prevalence of cardiovascular disease and events in the general population.